Leukocytes are true cells having nuclei and cytoplasmic organelles. They are classified according to the presence or absence of granules and their type in the cytoplasm into granular leukocytes and agranular leukocytes. Granular leukocytes, granulocytes, or polymorphonuclear leukocytes. They have in their cytoplasm, besides the primary azurophilic granules, secondary specific granules. According to the nature and the stain of these granules and the shape of the nucleus, granulocytes are classified into three groups: neutrophils, eosinophils, and basophils. Neutrophils, or polymorphs. Shape: they are spherical cells. Size: their diameter varies from 12 to 14 micron. Structure: nucleus. In neutrophils, there is one segmented or lobulated nucleus formed from 1 to 5 lobes connected together by thin chromatin threads. In females, the nucleus possesses a drumstick-like structure called the bar body or sex chromatin, which represents an inactive coiled X chromosome. Cytoplasm of neutrophils contains few organelles: Golgi apparatus, rough endoplasmic reticulum, mitochondria, ribosomes, and numerous fine neutrophilic granules of two types: primary or azurophilic granules, which appear large, less numerous, and darkly stained. They contain lysosomal enzymes and may be considered as lysosomes. Secondary or specific granules. They are most numerous, smaller, and lightly stained. They contain alkaline phosphatase and phagocytin, which is a bactericidal enzyme. Color. Neutrophils are colorless, need to be stained for examination. Lifespan. Neutrophils have a short lifespan, less than 1 week. Number. The percentage of neutrophils ranges from 60 to 75% of the total leukocytic count. Abnormalities in number. An increase in their number is called neutrophilia, which occurs in certain acute pyogenic infections as abscesses and acute tonsillitis and appendicitis. A decrease in their number is called neutropenia and is caused by the same causes of leukopenia. Functions. Neutrophils have specific molecules on their surfaces, allowing them to adhere to endothelium, thus helping immigration into the tissues, where they perform their functions outside the bloodstream. Neutrophils form the first line of defense mechanism during acute inflammation through phagocytosis of microorganisms, as they have receptors on their surfaces to recognize the foreign materials. Secretion of proteolytic enzymes, which cause lysis of the bacteria and the surrounding connective tissue, thus forming pus, which in turn prevents spreading of the bacteria to the surrounding. Other important functions of neutrophils are stimulation of bone marrow to form new neutrophils, attraction of monocytes to the site of infection, secretion of trypsin, which helps in healing by stimulation of fibroblasts to form new connective tissue. Neutrophils also produce pyrogens, which elevate the body temperature in order to inhibit the growth of bacteria. Classification of neutrophils. Neutrophils are classified according either to the number of segments in their nuclei or to the maturity. Earnest count is the classification of neutrophils into classes according to the number of segments in their nuclei, to show the young from old ones by increasing the number of segments. Class 1, 1 segment, 5%. Class 2, 2 segments, 35%. Class 3, 3 segments, 41%. Class 4, 4 segments, 17%. Class 5, 5 segments, 2%. Schilling count is the classification of neutrophils according to their maturity into myelocytes, metamyelocytes, step-nucleated or unilobed, and segmented or multilobed neutrophils. Myelocytes and metamyelocytes are only present in the bone marrow, while step-nucleated forms from 2 to 3% of the circulating neutrophils. An increase of their percentage is called shift to the left, which indicates the presence of infection that stimulates the bone marrow to manufacture more neutrophils. Some of them are not completely mature. Comparison between eosinophils and basophils. Shape. Eosinophils are spherical cells. Basophils are also spherical. Size. The diameter of eosinophils, the same as neutrophils, ranges from 12 to 14 micron, while the diameter of basophils is smaller, ranges from 10 to 12 micron. Structure. Nucleus. In eosinophils, the nucleus is horseshoe bilobed nucleus consisting of 2 lobes connected by thick chromatin threads, while in basophils the nucleus is irregular in shape, mostly S-shaped. Cytoplasm. The cytoplasm of eosinophils contains few organelles, abundant glycogen granules, and specific spherical acidophilic granules, which appear shiny red or orange red. These granules contain the usual lysosomal enzymes, lipid, and major basic protein responsible for acidophilia. The cytoplasm of basophils, on the other hand, also contains few organelles and large specific basophilic granules, metachromatically stained with toluidine blue. These granules contain heparin and histamine, similar to granules of mast cells of the connective tissue. Color. Eosinophils are colorless, need to be stained, and also do the basophils. Lifespan. Eosinophils have a short lifespan, less than 2 weeks. On the other hand, basophils have a very long lifespan, ranges from 1 to 5 years. Number. The percentage of eosinophils ranges from 2 to 5% of the circulating white blood cells, while the percentage of basophils ranges from 0 to 1% of the circulating white blood cells. Abnormalities in number. An increase in the number of eosinophils is called eosinophilia, which occurs in certain allergic diseases as urticaria, bronchial asthma, and in parasitic diseases, while a decrease in their number is called eosinopenia, which occurs after treatment with cortisone, and other endocrinal hormones. On the other hand, an increase in the number of basophils is called basophilia, which occurs in chickenpox and liver cirrhosis, while a decrease in their number is caused by the same causes of leukopenia. Functions. Eosinophils have a slight phagocytic action. They are concerned with the removal of histamine at the site of allergy by secretion of the enzyme histaminase. They engulf the antigen-antibody complexes formed at the site of allergy. On the other hand, basophils have also a slight phagocytic function. They are concerned with the secretion of histamine, allergic substances, and heparin anticoagulant. They are concerned also with the secretion of a slow-reacting substance of anaphylaxis. Cells involved in allergic response. These are cells related to histamine, either by secretion or removal. These cells include eosinophils, basophils, and mast cells of connective tissue. Cells involved in acute inflammation. These are some blood cells as neutrophils and monocytes, and certain connective tissue cells as mast cells and macrophages. Cells involved in chronic inflammation. These are non-granular leukocytes as lymphocytes and monocytes, and some connective tissue cells like plasma cells and other cells present in connective tissue derived from monocytes as macrophages and multinucleated giant cells. Agranulocytes or mononuclear leucocytes. They have in their cytoplasm only azurophilic granules, but they don't have specific granules. They possess a single non-lobed nucleus. They are classified according to the size of the cell and the shape of the nucleus into lymphocytes and monocytes. Lymphocytes. Shape. They are spherical cells. Size. There are small lymphocytes having a diameter that ranges from 6 to 8 micron, medium-sized lymphocytes, and large lymphocytes having a diameter that ranges from 12 to 15 micron. Structure. The nucleus in small lymphocytes is large, rounded, and darkly stained, while in large lymphocytes the nucleus also is large but lightly stained. Cytoplasm. In small lymphocytes is scanty basophilic, non-granular, and contains few azurophilic granules, while that in large lymphocytes is abundant, more basophilic, and contains increased number of organelles and azurophilic granules. Color. Lymphocytes are colorless, need to be stained for examination. Types. Small lymphocytes are a mixture of functional types, indistinguishable morphologically by ordinary means. The most common types are B lymphocytes and T lymphocytes, while large lymphocytes are only one type. Site of formation. B lymphocytes in birds develop in the pulsa fabricus, while in mammals they are produced in the bone marrow, while T lymphocytes are produced in bone marrow and their maturation depends on the thymus gland. Also do large lymphocytes. They are produced in the bone marrow and their maturation depends on the thymus gland. Lifespan in lymphocytes ranges from few months to several years. B lymphocytes have a short lifespan, few months, while T lymphocytes have a very long lifespan, several years. Number. The percentage of lymphocytes ranges from 20 to 30% of the circulating leukocytes. Small lymphocytes account for 15 to 20% of the circulating leukocytes, of which B lymphocytes less numerous, about 25%, while T lymphocytes more numerous, about 75%. On the other hand, large lymphocytes account for 5 to 10% of the circulating leukocytes. Abnormalities in number. An increase in number of lymphocytes is called lymphocytosis. It occurs in chronic infections as tuberculosis, syphilis, and whooping cough. Functions. B lymphocytes produce humoral immunity, in which B lymphocytes identify the specific antigen by the help of T lymphocytes. They become activated to large lymphocytes, then plasmablast, then plasma cells, which in turn secrete antibodies against the antigen. The antibodies, however, reach the body tissues via the bloodstream. Some activated B lymphocytes may remain as memory cells. These are conditioned cells that react rapidly to second exposure of the same antigens once more. There are many functions and several interacting subgroups of T lymphocytes. These are cytotoxic cells, memory cells, and regulator cells, both helper and suppressor. T lymphocytes produce cellular immunity, in which the antigens activate the T lymphocytes to change to killer cells or cytotoxic cells, which in turn secrete lymphokines to destroy the antigen. Some activated T lymphocytes may remain as memory cells. These are conditioned cells that react rapidly to second exposure of the antigens. Regulator cells, on the other hand, contain both helper cells, which stimulate the activity of B and T lymphocytes, or suppressor cells, which inhibit the functions of both types of lymphocytes, thus inhibiting cellular and humoral immunity. Therefore, these cells are called regulator cells because they regulate the activity of both types of lymphocytes, B and T. Large lymphocytes are directly cytotoxic and cause lysis of the target cells by contact. The mechanism of their action is not known and may be related to activity of azurophilic granules containing lysosomal enzymes. They are called natural killer cells and may be considered to be null cells, lacking both B or T cell surface markers. Lymphokines general characteristics. Definition. Lymphokines include several agents that cause damage to foreign cells or may perform other important functions. Functions of different agents. Interferon, a chemotatic factor which attracts macrophages to the site of infection and activates natural killer cells which are thymic independent and considered as cytotoxic cells. Migration inhibitory factors are agents which condense macrophages to the site of infection and inhibit their migration. Macrophage activating factor which stimulates activity of macrophages. Mitogenic factor that induces lymphocytic mitosis, growth and differentiation. Lymphotoxin, which is a cytotoxic factor to lymphocytes and other cells. Also, they contain different factors that increase vascular permeability. Monocytes. Sheep, they are spherical cells. Size, their diameter varies from 16 to 20 micron. Structure. Nucleus is large, eccentric, and kidney-shaped. Cytoplasm is basophilic, of frosty glass appearance, with no specific granules and rich in azurophilic granules containing lysosomal enzymes. Color. They are colorless, need to be stained like other types of leucocytes. Lifespan is short, less than 3 days. Number. Their percentage ranges from 3 to 8 of the circulating leukocytes or white blood cells. Abnormalities in number. An increase in their number is called monocytosis, which occurs in chronic infections as tuberculosis, syphilis, glandular and typhus fevers. Functions. They play a role in acute inflammation. They are highly phagocytic. In tissues, they are called macrophages. They can fuse with one another to form multinucleated giant cells, which are very important to engulf objects that are too large or resistant to phagocytosis by a single cell. Blood platelets or thrombocytes. Shape. They are small, non-nucleated bodies or disc-like fragments of cytoplasm. Size. Their diameter varies from 2 to 3 micron. Structure. Each blood platelet is formed of granulomere. A central basophilic granular portion is also called chromomere. By electron microscope, granulomere contains mitochondria, ribosomes, lysosomes, glycogen granules, serotonin-containing granules, and other platelet-specific proteins. Platelet also contains hyalomere, which is a peripheral clear zone. By electron microscope, it contains microtubules and microfilaments that help to maintain the disc shape of the blood platelets and act as a cytoskeleton. Color. They are colorless, need to be stained for examination. Lifespan is short, less than 2 weeks. Number. Their number ranges from 250,000 to 400,000 per cubic millimeter. Abnormalities in number. Decrease in their number caused purpura, a disease in which the bleeding time is prolonged. Functions. In stagnant blood, blood platelets produce coagulation, that is, formation of a red thrombus by deposition of fibrin threads, which in turn entangle RBCs, leaving serum which lacks fibrinogen and is similar to plasma minus its fibrinogen. In circulating blood, however, blood platelets produce homeostasis by agglutination and adherence of the platelets to the rough surfaces, producing white thrombus. Also, platelets release serotonin, which causes vasoconstriction.